Hello everyone, welcome back to the channel. If you are a medical student and you have just entered forensic medicine, you might be thinking, what exactly is forensic medicine? Why do doctors need to study law, and how is medicine connected with the court? In today's video, we are going to cover everything from the basics, starting from the introduction of forensic medicine, its history and scope, the definition, and finally an important concept, medical jurisprudence, along with its branches and differences. This video is completely designed according to standard medical textbooks and is especially useful for MBBS students. So, let's begin. Number 1. Introduction of forensic medicine. Forensic medicine is a unique and applied branch of medical science where medical knowledge is used to serve the law and justice system. As doctors, our role is not limited only to diagnosing diseases or treating patients. There are situations where medicine directly interacts with law, such as examination of injured persons in assault cases, post-mortem examination in suspicious deaths, sexual offense examinations, poisoning cases, age estimation, and medical negligence cases. In all these situations, the doctor acts as a medical expert for the court. Forensic medicine helps the doctor to interpret injuries scientifically, determine cause and manner of death, preserve and present medical evidence properly, and assist the judiciary in delivering justice. So, forensic medicine acts as a bridge between medicine and law, ensuring that medical facts are correctly understood in legal proceedings. Number 2. History and scope of forensic medicine. History of forensic medicine. The concept of forensic medicine is very old. In ancient civilizations, such as Egypt and China, there were records of examining bodies to determine cause of death. In Roman times, medical opinions were taken in legal matters related to injuries and death. One of the earliest documented forensic texts was written in China in the 13th century, dealing with death investigations. During the 18th and 19th centuries, forensic medicine developed rapidly in Europe with the growth of modern legal systems. In India, forensic medicine evolved during the British period and later became an essential subject in the MBBS curriculum. Today, forensic medicine is a well-structured scientific discipline, supported by pathology, toxicology, biology, and modern technology. Scope of forensic medicine. The scope of forensic medicine is very wide, especially in modern society. It includes clinical forensic medicine, examination of living persons in cases of assault, sexual offenses, intoxication, and torture, forensic pathology, post-mortem examination to determine cause, time, and manner of death, forensic toxicology, detection and interpretation of poisons, drugs, and toxins, forensic psychiatry, assessment of mental health in relation to criminal responsibility, forensic biology and DNA analysis, identification of individuals using biological evidence, medico-legal responsibilities of doctors, handling medico-legal cases, writing injury and post-mortem reports, giving expert evidence in court. Thus, forensic medicine plays a critical role in criminal investigation, civil disputes, and public health laws. Number 3. Definition of forensic medicine. Forensic medicine can be defined as the branch of medical science that deals with the application of medical knowledge to the administration of law and justice. A forensic doctor does not decide guilt or innocence. Instead, the doctor provides objective medical opinions based on scientific evidence. Number 4. Medical jurisprudence, meaning, difference, and branches. What is medical jurisprudence? Medical jurisprudence refers to the legal aspects of medical practice. It deals with rights and duties of doctors, doctor-patient relationship, medical negligence, consent, professional misconduct, medical ethics, and legal responsibilities. So, while forensic medicine helps the law using medicine, medical jurisprudence helps doctors practice medicine within the law. Difference between forensic medicine and medical jurisprudence. Forensic medicine applies medicine to legal problems. Medical jurisprudence applies law to medical practice. Forensic medicine, concerned with crime and justice. Medical jurisprudence, concerned with professional conduct. Forensic medicine deals with victims and accused. Medical jurisprudence deals with doctors and patients. Forensic medicine focuses on evidence. Medical jurisprudence focuses on legal responsibilities. Branches of medical jurisprudence: medical ethics, moral principles guiding medical practice; medical law, legal rules governing doctors; professional negligence, failure to follow standard care; consent and confidentiality, legal importance of patient rights; doctor as an expert witness, legal duties while giving evidence in court. If you understand these basics clearly, the rest of forensic medicine becomes much easier.
5. Recent advances in forensic medicine. Forensic medicine is no longer limited to post-mortem examinations and injury reports. With advances in medical science and technology, forensic medicine has become more accurate, objective, and scientific. A. DSD, disorders of sex development. DSD refers to a group of conditions where there is atypical development of chromosomal, gonadal, or anatomical sex. Earlier, sex determination was based mainly on 1. External genitalia, 2. Secondary sexual characteristics. But modern forensic medicine uses 1. Chromosomal analysis, karyotyping, 2. Hormonal assays, 3. Molecular genetics, 4. Imaging techniques. DSD cases are important in 1. Sex identification, 2. Medico-legal disputes, 3. Sports eligibility, 4. Gender assignment in newborns. A forensic expert must evaluate sex based on 1. Chromosomal sex, 2. Gonadal sex, 3. Hormonal sex, 4. Phenotypic sex. B. Age estimation of a child. Age estimation in children has become more precise due to modern methods. Traditional methods included 1. Eruption of teeth, 2. Appearance of ossification centers. Recent advances include 1. Dental radiography, 2. MRI for bone age, 3. Ultrasound for epiphyseal fusion, 4. Digital skeletal analysis, 5. Population-specific growth standards. Accurate age estimation is crucial in 1. Juvenile justice cases, 2. Child labor laws, 3. Sexual offense cases, 4. Sports age verification. Modern forensic practice emphasizes error margins and ethical reporting. 6. Mass disaster. A mass disaster is an event where the number of casualties overwhelms local resources. Examples include 1. Natural disasters, earthquakes, floods, 2. Man-made disasters, train accidents, fires, 3. Terrorist attacks, 4. Industrial disasters. Medical legal importance of mass disasters. In mass disasters, forensic experts play a crucial role in 1. Identification of victims, 2. Determining cause of death, 3. Issuing death certificates, 4. Assisting legal and humanitarian processes. Phases of mass disaster management. 1. Preparedness, disaster planning, training and mock drills, 2. Response, triage, emergency medical care, body recovery, 3. Recovery, identification, documentation, legal formalities. Forensic medicine ensures systematic and dignified handling of the dead. 7. DVI, disaster victim identification. DVI is a standardized scientific process used to identify victims in mass disasters. It is internationally guided by Interpol protocols. 4 phases of DVI. 1. Scene phase, recovery of bodies and body parts, proper labeling and documentation. 2. Post-mortem phase, autopsy, collection of fingerprints, dental records, DNA samples. 3. Ante-mortem phase, collection of data from families, medical and dental records, photographs and personal details. 4. Reconciliation phase, matching antemortem and postmortem data, scientific confirmation of identity. Primary identifiers in DVI are 1. Fingerprints, 2. Dental records, 3. DNA profiling. Secondary identifiers include 1. Clothing, 2. Tattoos, 3. Personal belongings. DVI ensures accuracy, dignity, and legal validity. 8. Sports medicine. Sports medicine is a multidisciplinary branch dealing with the medical aspects of physical activity and sports. Scope of sports medicine: 1. Prevention of sports injuries, 2. Diagnosis and treatment of injuries, 3. Rehabilitation and fitness, 4. Performance enhancement, 5. Anti-doping control. Legal aspects of sports medicine. From a forensic perspective, sports medicine is important in 1. Age verification in athletes, 2. Sex determination in competitive sports, 3. Doping control, 4. Assessment of sports-related injuries, 5. Medical negligence in sports. Doping and forensic relevance. Doping refers to the use of prohibited substances or methods to enhance performance. Forensic experts assist in 1. Sample collection, 2. Laboratory analysis, 3. Legal interpretation of results. These topics are not only exam-oriented but also clinically and legally relevant for future doctors.